Good day. Thank you for joining us for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabert-Schuster, State Director for AARP in this territory. Today we bring you an episode about a topic most relevant to older Virgin Islanders, one that touches the lives of millions of Americans across the nation, and that is affordable health care. Today we are joined by Shani Amory, Program Director for the Virgin Islands State Health Insurance Program, known as VI-SHIP, the Local Medicare Source provider. Today, Director Amory will shed light on the intricacies of Medicare and the significant impacts of recent changes. We will have an opportunity to explore the Inflation Reduction Act of 2022, a pivotal legislation that has introduced monumental changes to the cost of healthcare for millions of Americans, in particular, the cost of prescription drugs. Our discussion will reveal how these changes will affect Virgin Islanders, whether first-time enrollees or existing beneficiaries. We will also explore the critical role played by AARP in advocating for these changes, ensuring the needs and voices of older Americans and their families are heard and acted upon. From understanding the basics of Medicare enrollment to navigating the complexities of the recent changes, this program will help you understand the program that best suits your healthcare needs. And so we welcome Director Shani Amory. Thank you for being with us today.
Hi, good morning. Thank you for having me.
Yeah, and so first of all, tell us a little more about what your office does, VI-SHIP.
Okay, so VI-SHIP is an acronym for the Virgin Islands State Health Insurance Assistance Program, and we are the local Medicare source for Medicare beneficiaries, their family members, and caregivers who live and reside here in the Virgin Islands. We are federally funded by the Administration for Community Living, and we are locally administered by the Lieutenant Governor's Office. So we are here to assist anyone who's enrolled in Medicare to understand their options, to help resolve any Medicare billing issues, anything relative to Medicare, we are here to assist.
So you just deal with issues of Medicare only, not Medicaid.
Thank you. Yes. And I'm saying thank you because we often do get those phone calls asking if Medicare and Medicaid are the same. And our office deals specifically with Medicare. There are some individuals who are enrolled in both Medicare and also medical assistance, also known as Medicaid. Those are known as dual eligibles. So we do provide assistance to them as well. But anything having to do with Medicaid, medical assistance, and that enrollment and issues with that does have to go through the medical assistance program.
Excellent. Thank you for that clarification, because we do often get those questions at our AARP office as well. If people are supposed to call the VI-SHIP office to deal with Medicaid or just Medicare, etc. And so when people come into your office, tell us precisely now what they can expect to receive, especially when it comes to Medicare supplemental insurance.
So when individuals come into the VI-SHIP office, they can expect to meet with trained, experienced Medicare technicians. Okay, so we are trained in Medicare. We know what the new Medicare trends are. We understand what the issues are that people may have with Medicare. We sit with individuals. Every situation may be different from one to another. So we sit with them. We hear what their concerns are, what their options are. We help them to figure out what will be the best fit for them in regards to what Medicare options are available.
Now, historically, when people needed help with their AARP branded Medicare supplemental insurance. They went to the VI SHIP office. Since there were some changes in that for government retirees, we have had some AARP members say that when they go to the VI SHIP office, they're not getting the help that they need with the AARP branded Medicare supplemental insurance. Can you speak to that?
So individuals who are currently in the Medicare Advantage plan, for details on that plan, you do have to go through Department of Personnel to get information on exactly the details of what their plan and their coverage entails. We can assist in understanding, what the basics are, but we do recommend them to contact the reps that are on islands to get more, details on exactly what their coverage entails. So in regards to the Medicare supplement, also known as the Medigap policies, some individuals who come, when we sit with them and they understand exactly what their Medicare Advantage plan coverage details, oftentimes they find that they don't see the need to spend the extra monthly premium to cover the cost for the Medicare supplement plans, because the Medicare Advantage plan is so comprehensive. So I wouldn't say, it's not that I hope they don't feel as if they're not getting assistance from us, but we're just trying to explain to them that since you have this Medicare Advantage plan, there really may be no need for them to spend, for them to spend that extra income to go towards the Medicare policies that are available. But if they do choose to still have the Medicare supplement plan, that is an option for them. But here at VI Ship, we try to think of ways that we can also help them to save money. And the Medigap policies, they can be as high as like 157 per month. So if they can save that 160 per month by simply just holding on to the Medicare Advantage plan, we will explain that to them and encourage them to fully understand exactly what their Medicare Advantage plan does cover, because it is, for the most part, fully comprehensive.
Okay, now help me to understand all of this because I feel like I just became a little more confused. So we have the Advantage plan, that's the Medicare supplemental for government retirees. Is that correct?
Okay, so the Medicare Advantage plan is different from the supplement plans. So and I guess I can probably just briefly go over what the different parts of Medicare are. Okay, so we have the Medicare, we have the Part A and the Part B, which is known as original Medicare. So with the Medicare Part A, that is what is known as hospital coverage. So within hospital coverage, they have inpatient coverage. If they have to be admitted to the hospital, there also is within that coverage hospice care and also home health care as well too. Then we then have the Part B. The Part B is what we call Medicare coverage, and I'm sorry, what we call medical coverage. So with the Part B coverage, individuals would then have coverage for doctor services from providers, from doctors, and it will also cover preventive and wellness care as well too. So those are what you get through Social Security. Through Social Security, you can add on the Part A and the Part B. Okay, so after the Part A and the Part B, there's also the Part D prescription drug plan coverage, and that is when there is coverage to assist the beneficiary in covering a portion of their drug costs. Okay, so we have the Part A, the Part B, and the Part D. And then from there are also the Medicare Advantage policies, and there's also the Medigap supplement, also known as the Medigap is also known as the Medicare supplement plans. So the Medicare Advantage plan, those are offered from private insurance companies, okay, and they work with Medicare to offer, fully coverage for the Part A, the Part B. It will also typically provide coverage for prescription plans, and it will also have perks such as vision and dental, because Medicare itself does not provide coverage for vision or for dental. But through the Medicare Advantage plans, beneficiaries are able to not only get the Medicare Part A and Part B, but to also get the prescription, also to receive coverage for vision and for dental. So the Medicare Advantage plan, that is what Department of Personnel created for GVI retirees, okay, here in the Virgin Islands. So in contrast, the Medicare Advantage plan differs from the Medicare supplement plans, because the Medicare supplement plans, those typically supplement the Medicare Part A and Part B. Okay, so those are beneficial plans because, they will assist the beneficiary in covering their copays, their coinsurances, and it can also, depending on which plan within the supplement plans that are available, depending on which plan they pick up, they can also get coverage. It will also cover the Medicare Part B deductible. So that's how they differ. So, they're both offered from, private insurance companies, but the Medicare Advantage is holistic in that it will offer coverage for Medicare Part A, the Part B, and it will also provide prescriptions and also vision and dental. Whereas the supplement only supplements the Medicare Part A and the Part B. Part A being hospital and Part B being medical.
Okay.
And I'm smiling because I'm hoping I'm not confusing you more, Troy.
Yeah, let me try to unpack this. Okay, so we talk about
Okay,
all
let's
these
go.
different parts, right? So the Medigap, what part is that? We talked about part A, part B, part D. Is there a
Mhm.
part C, a part E, a part F, a part
Okay.
something else?
Okay, so the Medicare Advantage plans, those are known as the Part C. That is what is known as Part C. So Part C is Medicare Advantage plans. The Medicare supplement plans, they're known as just that, either Medigap or the Medicare supplement plans.
Okay, so the Advantage plans, that's part C, is only available in the Virgin Islands to government retirees. Is that correct?
That is correct. So that is something that was an effort that Personnel did a few years ago, where they create a plan with United Healthcare AARP to create a retirement plan, a Medicare Advantage plan for their retirees who are 65 years and older and on Medicare.
Okay, so for a non-government retiree, a non-government Medicare beneficiary, right, who is never a government employee, they can get a Medicare supplemental plan, correct?
That is correct. So, individuals who are not GBI retirees, there are still other options available to them. They can pick up the Part D, which we strongly encourage, and they can also pick up a Medigap or a Medigap slash Medicare supplement plan. And that's where we get into the different plans like Plan F and Plan G. So, the Plan F and Plan G, those will fall under the Medicare supplements or slash Medigap policies.
Okay, so for a government retiree, right,
Mhm.
who has Medicare Advantage, the Part C, is that enough or should they also get the Medicare supplemental plan on top of that?
I had the opportunity to sit in with one of the trainings that they had previously for the retirees, and when I saw the details of the Medicare Advantage plan, to me it's so comprehensive. A lot of the services for the beneficiaries will be $0 copay already. So I would say that if a beneficiary wants to sign up for the Medicare supplement plan, we can assist them with that. However, I and I would say it all depends on what the needs of the beneficiary are. So we can help them, to understand, what their needs are and why they think that they may need a supplement plan to assist them. But for the most part, we encourage beneficiaries that with the Advantage plan, it is so comprehensive that they can consider not picking up the supplement Medigap policy, and they can still feel comfortable in their coverage.
Okay, very good. And for non-government retirees who will go to the Medicare supplemental plans, are those also as comprehensive or even more comprehensive than the Advantage?
So the only thing that is different from in comparison to the Advantage and the supplement is that the supplement is not going to provide coverage for prescriptions, nor is it going to provide vision and dental, whereas Advantage plans do typically provide that coverage. However, many beneficiaries do enjoy the supplement plans because when they go to the doctor and they give them their Medicare card, the red, white, and blue card, also provide them with the supplement card. They don't have to worry about how much you're going to have to pay out of cost for this visit. So when they go and they provide their providers with both cards, that supplement card is going to cover their copays and their deductibles as well. So a lot of beneficiaries they find it to be beneficial, and it's more so ease for them instead of having to wonder, oh goodness, how much I have to pay today out of pocket.
Okay, excellent. Well, I'm much more clear on this now, and I hope our listeners and viewers are as well, because if I'm confused, I'm sure they were confused too. It's all like rocket science trying to figure this out. And we do get so many questions at our AARP office, and most of the time we don't even know how to answer those questions. We just have to refer them to your office. So thank you again for those clarifications. Now, we often hear about open enrollment period. Tell us about that and what happens during that open enrollment.
So during Medicare open enrollment, which runs from October 5th to December 7th every year, this is the time of the year for beneficiaries who are on Medicare who do not have the Part D prescription drug plan. Now is the time for them to join the plan. So when they contact our office and they do join the plan will be effective January 1st, 2024. Okay. Many beneficiaries who come in, they may have been on Medicare for, let's say, 10 years, and they say, well, I've been healthy all these years. I take my vitamins, I drink my bushy every morning. However, I need the prescription coverage now because I have some health issues now at this point. So they can only join then during open enrollment, like I said, which is between October 15th and December 7th. But the thing is that when they do join the plan, they are then going to be hit with a late enrollment penalty for all the months that they were uncovered. For all the months they did not have any creditable coverage that provided prescriptions coverage, they will be they will have a penalty for every month. So typically it can be about 30 cents per month. So this is why we strongly encourage beneficiaries that they don't have the Part D plan now to please join the plan now, because if they don't do so, not only will they have a LEP when they do decide to join, but in addition, you also have to understand that, let's say a beneficiary doesn't join the plan right now. They say, you know what, I'm drinking my tea, I walk every morning, I'm fine, I'm healthy. Let's say their circumstances change in February. Okay. So in February, they then learn that they now have high blood pressure. They may have a congenital heart disease as well too. They will have, and they contact our office. Their child may call, their wife may, their husband may call, their spouse may call, and they are just, worried right now. We have these meds to take. The meds are very expensive. We need the Part D. Unfortunately, Medicare will not allow us to enroll that person into a Part D plan until open enrollment. So now we have from February until December where they have to pay the full amount for their prescriptions out of pocket. So that's just a draw picture of the phone calls that we get often outside of open enrollment from beneficiaries who are in dire need of prescriptions, and they now have to spend the full amount out of pocket because Medicare only allows the enrollment into the Part D plan during certain times of the year. So I really want to strongly stress, if you do not have if you don't have the Part D plan right now, even if you are healthy, you may be, a healthy, like a 25-year-old, who exercises every single day. Strongly encourage you to get the Part D plan now, because you don't know what may happen a few months from now. You also don't want to be hit with that penalty that is going to be added on for the lifetime of your plan for every month that was uncovered.
Okay, now during open enrollment, do they also have to enroll for Part A and Part B, or is that an automatic enrollment when you reach a certain age?
Okay, so good question. So outside of open enrollment, Medicare also has the initial enrollment period. And this when beneficiaries are able to first join Medicare. So this is a 7-month period. So it begins 3 months before the person turns 65, the month when the person is turned 65, and 3 months after. So during this time, this is the time when they should be contacting Social Security to say, hi, I'm making 65. I need to join Medicare. Okay, so if the person does not, let's say, for example, the person turns 65 in April, right? So they can actually contact Social Security from January to begin the enrollment process. That would be 3 months before January, February, March, right? So then the 3 months will be January, February, March. April will be the fourth month when they actually turn 65. And then 3 months after April will be when their initial enrollment period ends. So from January until what? July, they are able to join Medicare and add on the Part A and the Part B, or they can sometimes individuals who are still fully employed may opt to just only pick up the Part A. Okay, so um, when individuals do not join Medicare during that 7 month initial period, they then have to wait during general enrollment, which runs from January to then join Medicare. So let's say the beneficiary he made 65 on April 1st, right? If he did not pick up Medicare by 3 months after his April birthday, he has to then wait until January to join Medicare. And then at that point, there's a possibility that he may have a late enrollment penalty for not joining Medicare during his initial period.
Okay, so for our listening and viewing audience, again, it's so very important that when you're approaching the age of 65 or very shortly thereafter, within 3 months after, please do enroll in Part A and preferably Part B as well, or else you could have a lifetime penalty, as you're saying, right?
Yes, and if they contact VI Ship, we have beneficiaries who call us. They say, "Listen, I'm making 65 next June, and I want to begin, to understand what my options are, what I need to do." So I commend people like that. When you're making 65, begin to contact VI Ship. Give us a call. We can help you to understand, when you should enroll, when the cutoff period will be, and to also understand what your options will be once you turn 65. You may still be working. So we may tell you, well, you can still join Medicare, but only get the Part A because you still have that creditable coverage from your employer. So you're still going to be working even though you're 65. So we can discuss with them what all their options are.
Okay, excellent. So now, for more than 60 years, AARP has led the fight for a law that would make prescription drugs more affordable for older Americans. This was finally realized when President Biden signed the legislation in 2022 that would combat the soaring costs of prescription drugs. Can you discuss the recent changes to Medicare, particularly those related to the lowering of medication costs following the enactment of the law, now known as the Inflation Reduction Act of 2022?
Okay. So the Inflation Reduction Act, what's going on right now is very beneficial for Medicare beneficiaries because it's going to lower the prescription drug costs for thousands of for many individuals in the United States, especially those who are on Medicare. So some benefits that people with Medicare can expect is that they're not gonna pay no more than $35 per month or less than that for their insulin, for their Medicare covered insulin prescribed medications. Okay, and that will be even if they do not meet their deductible for the Part D drug plan, they can still enjoy the benefit of not having to pay more than $35 per month for their insulin prescribed medication. Okay, there is also free recommended preventive vaccines for Medicare beneficiaries as a result of IRA, of the Inflation Reduction Act. And eventually, there's like a timeline of events, okay, for with the Inflation Reduction Act. So by 2025, beneficiaries are also gonna enjoy not having to pay more than $2,000 out of pocket for their prescription drug costs. Okay, so how the prescription drug plan works is that depending on what tier the drug falls into, that determines how much the beneficiary has to pay out of pocket. So that out of pocket cost for the prescription is not going to surpass $2,000, and we're going to see that in play by 2025. Okay, and then by 2026, you can expect to begin paying lower prices for selected drugs. Okay, through their Medicare Part D coverage. So it's amazing what the Inflation Reduction Act is putting into effect right now. And um and especially because many beneficiaries, and especially older Americans, oftentimes they may need prescriptions, but they are not getting it because they think the cost is too high Okay, so right now Medicare is negotiating with drug companies to lower the costs. So it's a great thing, that's going on with the Inflation Reduction Act, definitely, especially for our Medicare beneficiaries.
Excellent. Now, thank you for explaining that. And again, for our listening and viewing audience, this has been a major accomplishment for AARP nationally. At our heart, AARP is a social mission organization. The work that we do is advocacy and community outreach. We are not an insurance company. We talked a lot about Medicare supplemental insurance today, and as I use the term, AARP branded Medicare supplemental insurance. AARP does not provide that. That is provided by United Healthcare. It's very important to understand that AARP is not an insurance company. We do not sell any insurance products. We do not provide any insurance products at all. There are some insurance products that are carrying the AARP brand, but not provided by AARP. And so, as part of Cape from Capitol Hill to every state and municipality across the country, including the territories of Washington, D.C., Puerto Rico, and the Virgin Islands. But this Inflation Reduction Act is the pinnacle of our most recent work, our most recent advocacy in Capitol Hill and in the White House to bring about this new law to reduce the cost of prescription drugs. So it's a great accomplishment of ARP. I'm so very pleased with it, and we just want the listening and viewing audience to be aware that AARP had a very significant impact in this advocacy. And so, if you will, just tell us, Shani, about how people can get more information on your office and what you all do, and how they can come in contact with your office so they can get the assistance that they need.
Okay, so we have two offices here in the VI. We have the St. Thomas office, St. Thomas, St. John. We are located in Niski Center on the outer part where immigration used to be. So if you're actually driving and you're going towards sub base, we're in that big parking lot. You see our sign that says Office of the Lieutenant Governor. We're right in there. And on St. Croix, we are currently at Wang F. Louis Hospital, but we are going to be relocating soon. So once that move does take place, we will of course notify the public so that our beneficiaries will know exactly where to find us on St. Croix. Um, what else? So a part of what we do at VI Ship is that we also do a lot of outreach events in the community. During the pandemic, we had to pull back on serving the beneficiaries in person because they were our most vulnerable population in regards to COVID, but now we are out and about. We have been to the fair, the last 2 years on St. Thomas, the cultural fair. We did the St. John fair this year. We also did the cultural fair on St. Croix, the agricultural fair on St. Croix as well too. We will be to the fairs again in January on St. Croix also, so you can look for us there. You see our table, and we'll be there. And when we go out and we do these events, we're there with our flyers, with our giveaways. We have, our totes, our water bottles, so that you can always know how to get in contact with us. Okay, when you're
Shani,
sipping your
thanks
water,
so much.
you'll know.
We're fresh out of time, but again, thank you. We've been speaking with Shani Amory, the director of the VI SHIP office, State Health Insurance Program office, and thanks so much for your information. We look forward to having you on another show in the near future. Thank you.
Okay, thank you.